1 in 7 people in the United States who are living with HIV don't even know it and need to be tested for the condition. That's according to HIV.gov. Today we're talking with nurse practitioner Zach Backlin. We'll cover HIV treatment, testing options, and more, breaking down years of stigma to help you, our viewers, on a journey to being well.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you so much for joining us today for Being Well. I'm your host, Lacey Spence, and today we are welcoming Zach Backlin onto the show. He's a nurse practitioner. Welcome. Thank you for joining us.
Thank you for having me.
All right. So first off, there's a new facility in Mattoon that you are working at. Now, we're taping this in June, but just opened yesterday. Mm-hmm. So can you tell us a little bit about that?
Well, it's multi-specialty care. I am staffing the walk-in portion of it. We have Dr. Angela Azor staffing the family practice, and we have Prairie Cardiology coming in several days a week, along with a couple other specialties. Orthopedics is going to come in a few days a month, and GI.
Awesome. It's a one-stop shop, and it's HSHS Medical Group, correct?
Mm-hmm. Yes.
Excellent. And so our topic today, we are discussing HIV. Used to be a humongous problem in the United States. Can you tell us just a little bit of background, what the condition is?
So it's a virus, usually contracted through bloodborne contact of some kind. Primarily affects the immune system. When left untreated, ends up with people catching opportunistic infections that eventually kill them. So it's pretty insidious, but medications nowadays are pretty effective.
And so it basically it weakens the body. You don't have as much of a fighting chance if you get an illness. Mm-hmm. Gotcha. And so you're pretty passionate about treatment and testing. So which would you like to launch into first?
Testing is pretty simple. Nowadays there's even at-home test kits where you can either prick your finger or take an oral swab and send it into a lab. There's rapid point-of-care testing as well. Usually we start with testing for the antibody. The test itself now has evolved from the old ones that you used to see in the textbooks. It starts with looking for the antigen to the virus, and if not positive or positive, it'll look for the antibodies. There are two strains of HIV. Mm-hmm. Primarily HIV-1 is what we see in the United States. Tends to affect you faster, and mortality is higher. Then there's the second one, which we don't see too much of here. Less, I think, than 5% of people outside of Africa come down with HIV too. It's slower, and but it's also more resistant to the medications that we have now.
And so as we talk about the medications, what does treatment as prevention look like?
Okay, so the idea behind treatment as prevention is that if we can prevent people from becoming infected, then we can cut down on the transmission rate and hopefully eventually eliminate it from our population as a whole. To that end, there are several medications. Pre-exposure prophylaxis is the big one. You've probably seen the commercials for some of those drugs on television. It's a once-a-day medication that, if you're at risk for exposure, reduces the chances that you'll contract it.
And in general terms, which populations or people need to be on the lookout for this or take advantage of that?
The big one that I dealt with is people who suffer from substance use disorders. I'm told that's pretty prevalent in the communities around here, unfortunately. Anyone who's injecting drugs intravenously or intranasally, like snorting drugs through a tube, or people who are having unprotected sex.
Gotcha. And so as we're looking at those populations of people, there are ways to help these people prevent getting the virus, correct?
Yeah. The pre-exposure prophylaxis is the big one. Like I said, it's once a day. But the other thing is that if you have a partner who is HIV positive, nowadays they've discovered that if they're taking their medications as prescribed, their antivirals, and that their viral load is undetectable, there is effectively no risk of transmitting it to their sexual partners.
And that's what I was going to ask you. Undetectable, what does that entail? What does that mean?
So when we're monitoring the lab levels of a patient with HIV, undetectable means that their viral load is less than 200 parts per million. So there is not enough virus circulating through their bloodstream to be detectable by our modern day lab tests.
Gotcha. And then that's where you said when it's lower, that's where you're not able to transmit it?
Yes.
Gotcha. And so then also treatment does not equal a cure. Can you talk about that?
So treatment is lifelong. While it is effective and it gets people to the point where they're living into their 70s and 80s, you can't stop taking your medication. You have to continually take it every day. Otherwise, the virus will bounce back. It still is there, present in your system. It's just hiding, so to speak, from the medication in layman's terms.
Gotcha. And so as we're talking about testing options, you kind of talked about being able to, test in the privacy of your own home. Again, why is it so important for folks to test early so that it doesn't progress maybe into something worse?
So the earlier we can identify patients who are HIV positive, the quicker we can get them into treatment. The quicker we get them into treatment, the more we reduce the potential for later on complications down the road. The opportunistic infections and such.
And then in the past couple of years, have there been any changes in drug regimens or, basically being able to, attack this more efficiently?
Absolutely. Previously, drug regimens were complicated. They were multi-pill, taking it multiple times a day, and the side effects were less than ideal. Nowadays, our antiviral medication is a lot more effective. Most of the newer medications have a high barrier to resistance, so people taking them, if they miss a dose, which is not ideal, but it doesn't necessarily mean that missing one dose will mean the virus becomes resistant to the modern day meds. And they are a lot easier to take, less side effects, and once a day multi-drug pills are a lot easier to handle than trying to figure out when during the day you have to take multiple pills.
That's incredible, and I'm sure that has definitely helped with mortality rates from this.
Absolutely. Like I said, we are seeing people who are living a lot longer, and we're actually starting to get data on complications that we hadn't previously seen because people were dying at such a young age from this. That the virus long-term has other systemic effects on the body. It can affect the heart, it can affect the bones, things like that. And what we're learning from it now is so much more than what we knew before.
When would you say that change started to take place, like just this new landscape of complications that you had to kind of work through?
I would say within the last 10 to 15 years, more than likely. As our medications got more effective, we started realizing that this long-term effects are still something we have to watch and monitor. That's why people with HIV should ideally be seeing their primary care provider at least every 6 months.
And what leads up to HIV transitioning to AIDS?
So AIDS is listed as stage 3 of the virus's progression. Essentially, the criteria we're looking for there are the level of CD4, which is a white blood cell, being less than 200, their viral load continuing to be uncontrolled. And we're also looking for those complications, those opportunistic infections. If someone reaches the AIDS portion, they usually have an opportunistic infection that has taken hold, or their immune system has become so compromised that we're worried about the risk of opportunistic infections.
And are you able to talk about what the infection rate looked like, again, maybe 15, 20 years ago as compared to now?
It's going down to a certain extent, but the opiate crisis has drawn the rates back up somewhat. The opiate crisis in general has kind of caused a resurgence in some populations, because when we have people who were using these opiates before, they were getting prescribed them, or they were getting them from surgeries and then they were becoming dependent on them. Our attempts to address the opiate crisis have led to almost kind of a lockdown on prescriptions. In that case, when you have people who are dependent on these drugs, or they are addicted to these drugs, and we are no longer providing them because it's unsafe to take them long term, they're turning to heroin and fentanyl on the streets, and they're usually using it in unsafe manners that are spreading the virus again.
And it's just crazy to see how many effects the opioid epidemic can have, and then it trickles out to even this.
Yeah, it's one of those pendulums that hopefully will start swinging back towards the middle. We for so long were focused on treating pain that in some cases we lost perspective, and it led to a lot of people becoming dependent on these medications. When you take opiates long term, unfortunately what ends up happening is, after a while, maybe the source of your pain is no longer there, your injury or your surgical wound or whatnot, but your brain has gotten so used to having that medication in it that when you stop taking it, it's signaling itself that it still thinks that there's pain in that area. And so then you're incentivized to take the medication again, even though you may not actually have the reason you were taking it to begin with. And that's where we fall into the cycle of addiction.
And so as you're talking about folks who are maybe moving to alternative means of getting this, how important are syringe exchange programs and things of that nature, basically to curb spreading HIV?
They are very important. Unfortunately, our society has kind of taken the stance that syringe exchange programs enable people who are addicted to medications, to opiates especially. It's really not the case. Their substance use disorder is going to drive them to use, whether they have clean needles or not. But providing clean needles to this population helps them twofold. A, it helps cut down on the rate of transmission of bloodborne pathogens, because they're not sharing needles, they're using clean needles each time they use. And B, it actually provides for an opportunity for us to engage them in treatment. If we can make that contact with them, if we can build that trusting relationship with them, we have an opportunity to help them hopefully overcome their substance use disorder.
And do you find often that folks who are struggling with HIV or who need treatment are populations who are often missed?
It's still very stigmatized, unfortunately. Historically, when we first noticed HIV as a virus and identified it, it was primarily seen in populations that are stigmatized by our society. That has since no longer been the case. I mean, we're still looking at a high rate of HIV in minorities, primarily. African Americans have an extremely high rate of HIV infection. And they are a part of society that tends to not be engaged in care, and that's something that we need to focus on and change. We need to engage people who are stigmatized and ostracized from society, because they need medical care too.
Which is exactly who we're trying to reach, with programs like this. to get folks like you to say, hey, if you can, seek treatment for this. And like you said, testing being so important because it can lead to much worse conditions for you, for the folks that you are with. And you and I were talking before the show about the U equals U movement. Are you able to kind of explain what that is?
So it's the public health movement to drive testing and treatment for HIV. The acronym stands for undetectable equals untransmittable. And it's like I alluded to in the beginning of the program, when your viral load is undetectable and you are taking your medication as prescribed and making those 6-month, those year appointments, getting your load checked, you cannot transmit the virus to your sexual partner. Now, there is still a small risk of transmitting it to someone you're sharing needles with or injecting with, but it's still a step in the right direction.
And so if I'm someone who thinks that I might have been exposed to HIV, what are my next steps as far as testing? Where do I go to? Does it have to be a clinic, the health department? Please walk me through that.
The health department is always an option. You can come to pretty much to any primary care clinic and get the test. It's just a small vial of blood. It's not that complicated. Usually results are within 24 to 48 hours. And the goal is treatment as soon as possible. So if you were to come back positive, we would immediately put you on an antiviral medication and start treatment that day. There's really no contraindication to that.
And if I'm someone who maybe doesn't have maybe the best insurance or things like that, are there resources out there for me to get the treatment that I need?
Yes. Your health department would be the first place to go. There are a lot of grants and funding for helping people who don't have the resources to obtain their medication get it. The companies that make the antivirals are very, very good at giving that medication away because their goal is elimination.
Sure. And other than the health department, is there anywhere else that I need to go or that I can check out?
I would start by just Googling AIDS foundations on the internet, HIV foundations. There are a myriad of different groups out there that will even cater to specific minorities or specific subgroups of the population. There are a lot of support groups out there. There's a lot of help.
Sure.
It's just getting you to help, getting you to the help that you need, essentially.
Is there anything that's maybe like little known facts or little known struggles that folks in the HIV community face?
Stigma is still the big one, unfortunately. This is a virus that we can control, that we can help people live long lives with, but the stigma associated with it makes people reluctant to get tested and get treated. Ideally, every person, whether they're high risk or not, between the ages of 18 to 65 should be tested at least once in their lifetime. If we can get enough people into treatment, we can cut down on the transmission and we can eliminate it from our population entirely.
And how do we work towards breaking down this stigma?
Outreach programs. The syringe exchange programs are a great way to start. You're engaging them where they're at. When we have people who are reluctant and afraid to come and get treated, meeting them where they're at is a huge thing. If we can break down that barrier and say, hey, we recognize you're high risk, we recognize you have this, we want to help you, we can get better engagement and people to come and meet us halfway.
And even besides an outreach program, family support units, how those can play an important role too?
Absolutely. Getting people to realize that this should not be the stigma that it is, and helping them understand that now with our medications these days, HIV is a chronic illness and really no different than diabetes or hypertension. We just got to treat it like any other disease.
And so if there's someone watching who's maybe new to the idea of HIV and they have no clue about it, what are symptoms that folks can be on the lookout for?
Well, in the early stages, it's going to seem almost like a flu-like illness. They're going to feel fatigued. They may feel a little feverish. They might just not feel well, tired, sleepy, like they've got a cold or a cough that just does not go away. Once that initial period ends, there's really not going to be any symptoms until it progresses to the later stages of the disease. Some people may never develop symptoms for 5 to 10 years after becoming infected, which is why testing is so important.
And definitely an interesting time that we're living in, that it presents flu-like symptoms with everything that's gone on this year with COVID and things like that. And so the symptoms that could present later in the condition, what do those look like?
Those are going to be the opportunistic infections. The big one that used to be seen a lot and isn't so much anymore would be the Kaposi sarcoma, which is a cancer of the skin. When we first saw that, it was mostly seen in elderly men from the Italy region. It just, for whatever reason, was endemic to them. And then we started seeing it in AIDS patients and started realizing that it's a cancer that shows up when your immune system isn't working all that well. There are certain types of pneumonias that we'll see that are very specific to having advanced HIV.
And when you talk into getting into stage 3 and into AIDS, what effect, I mean, it's pretty detrimental on the body?
It is. Usually we'll have to give those patients some form of prophylactic antibiotics just to ensure that they don't develop these pneumonias and these opportunistic infections.
And I know that you give presentations on this topic. Is there any particular reason why you feel the need to educate folks about this?
Well, I mean, I've worked in the past with people in residential substance use. A lot of times when I would see them in the office, they were upset because they felt like they had been ignored. Frequently, I would unfortunately have to send them either to the hospital for some, imaging or something that I needed done on a really timely basis. And they would come back to me a day or two later and say, as soon as I told them that I had a history of using meth, they didn't want to do anything with me. They just said, stop using meth, and walked me out the door. And so when you have that attitude, you're not going to get the response that you need. You're not going to help these people stay healthy. You're not going to help them get better.
And so again, your goal, education, outreach, getting this population, these folks, the help they need.
Absolutely.
Gotcha. We've got just a few more minutes left. Is there anything else that you would like to share with our viewers that might help them, whether it be resources or any other tidbits?
I would just pretty much say that if you feel like you want to get tested, or if you're concerned that you might be exposed, come see me. I'm not going to be judgmental. I'm not going to focus on those things. I am more than willing to help.
Very well put. All right. Well, thank you so much for joining us today. And that will wrap up this episode of Being Well. And for more information, you can visit our website, WEIU.net. And again, thank you so much for being here.
Thank you for having me.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.